And thank you very much for the invitation to talk about this. Well, the European Society of Medical Oncology welcomes the HTA regulation. It will kickstart joint work on cancer indications, as we heard, and advanced therapies. And the new regulation is an important opportunity to improve access to innovative therapies, provided that the intended joint work, so the joint clinical assessment and consultations, is implemented in a consistent manner across the entire European Union. As to the opportunities of the HTA regulation and the unified procedures that comes with this, the new legislation may lead to enhanced accountability of reasonableness in the HTA process across Europe, as it will help develop a high level of expertise in the evaluation of clinical benefits of new cancer therapies. It will also enable pooling of expertise from countries and relevant European bodies involved in joint HTA work. And furthermore, new measures, including reporting from the new EU bodies and publicly accessible web page of the IT platform, will improve transparency of HTA processes. The regulation through the joint EU-wide work on HTA holds great potential to reduce fragmentation and unnecessary duplication of HTA processes, which could impact patient access to innovative cancer treatments. And moreover, the HTA regulation sets the foundation to create infrastructure for a centralized approach to market access agreement negotiations. And this could be particularly advantageous for those countries that struggle to access certain medicines due to their relatively weak negotiating position. Finally, the new legislation provides an opportunity to enhance the sustainability of healthcare systems, as it will improve the value of care by prioritizing market access to high-value therapies. It may also contribute to better pricing by developing a centralized approach to market access negotiations, which could also impact price transparency. As to the potential challenges in implementing this regulation, it's key that health professionals understand how to impact decision-making in HTA and inform the overall process. As such, there is a need to raise awareness and educate oncologists on these issues. And what's more, a common problem for clinicians is understanding and articulating the trade-off between value for money, the intrinsic value of cancer drugs, and the health impact on a country's population. It may also be challenging to report how a surrogate endpoint is relevant and what the perception is on toxicity benefits of medicines. Thank you.
Thank you, Elisabeth. Very clear and very much to the point. I will pick up on one of your last comments. One of the known authorities in the field of HTA on both sides of the Atlantic, Tom Banta, said years ago already that, of course, HTA is a public health function, exactly on the point where you expressed your, let's say, challenge, because it is clear that the clinician is interested primarily in the benefits for the specific patient. Of course, I'm not underestimating the care for the broader community in terms of the community of oncological patients, on patients that suffer from the same organ cancer and similar. But of course, sometimes it is difficult to reconcile. In any case, given that you so nicely outlined the envisaged benefits and challenges of the new system, how does ESMO prepare for the implementation of the HTA system?
Yes, so ESMO has prepared itself by trying to be a major resource to assist HTA process. And it has therefore developed several tools built which also could support the clinicians in this process of thinking wider than just your only patient. So first, I will tell about tools. First, the ESMO magnitude of clinical benefit scale. This was developed to assess the value of cancer care and prioritize medicines and address the challenges of the appropriate use of limited resources to deliver cost-effective and affordable cancer care. When used from the outset of joint clinical assessments, ESMO MCBS may be instrumental in prioritizing medicines and help to avoid duplicates of effort. It is used as part of HTA processes by authorities, regions, and oncology societies in various countries, including Australia, Austria, Belgium, Brazil, Germany, Israel, Singapore, South Africa, and Spain. The ESMO MCBS version 1.1 for solid tumors will soon be upgraded to version 2. And moreover, the ESMO MCBS version for hematological malignancies will also soon be released. The second one, the SCAT scale. It's a scale for clinical actionability of molecular targets. It contributes to the rapidly evolving field of precision medicine. And this scale aims to facilitate identification of those patients with cancer likely to respond to precision medicine. It also defines clinical evidence-based criteria to prioritize genomic alterations as markers to select patients for targeted therapies. This scale may be a helpful tool to inform on the value of new medicines, the priority setting, and coverage decisions. Then an approach to identify bias in studies. ESMO has described a structured approach to identify bias that may distort the results of clinical studies. And this approach may help when enhancing nuance in HTA evaluation processes. Then an approach to a structured HTA decision approach. ESMO, with the London School of Economics, is developing a weighted approach to structured HTA decision-making, and these efforts may help create an infrastructure for centralized approach. As such, ESMO is developing a geographically adapted value-based reimbursement model to tackle issues related to the reimbursement of expensive, innovative medicines. When completed, it may be of great value for supporting reimbursement decisions made at the national level. Then ESMO's clinical practice guidelines. They are prepared and reviewed by experts and based on the findings of evidence-based medicine. They provide medical oncologists with a set of recommendations to provide the best care options. And finally, ESMO surveys. ESMO studies and monitors the availability, out-of-pocket cost, and accessibility of cancer medicines globally. Work is ongoing on version 2 of the anti-neoplastic medicine study, which lays out the extent of current inequities in accessing cancer medicine. ESMO is also conducting a study on the availability and accessibility of biomolecular technologies in oncology in Europe to provide a comprehensive overview of availability of molecular technologies. Finally, ESMO stands ready to help the EU institutions, HTA bodies, and the wider healthcare professional communities implement this HTA regulation through the support and its dedicated tools and members' expertise. Thank you.